Now let's talk in some more detail about incident command features and concepts. So one of the most important concepts here under the incident command system is management by objectives. And there are three essential objectives that we will talk about, but I just want to highlight that everything sort of flows from the objectives. Other elements of the incident command system as depicted on this slide include a common terminology. We talked about avoiding jargon and speaking the phrases plain English as a euphemism. Use of position titles. Importantly, one's position title under the incident command system should use the formal terminology of incident command, not one's day-to-day job title. You could imagine how confusing it would be if someone from agency A is substance abuse counselor 3 and someone from agency B within that same jurisdiction is substance abuse counselor 2, or from a different jurisdiction, and they both do the same things on a day-to-day basis, but it would create a Tower of Babel if we used one's day-to-day job titles. So that's why we use standardized position titles that we're describing here in this presentation. There's a concept called manageable span of control that we'll talk about, where for any box on the incident command system chart, and it also applies to the unified command and area command chart, we can add boxes under the F, the L, the O, and the P. There should never be fewer, ideally, than 3 boxes underneath a given box, and there should never be, ideally, more than 7 boxes under a given box. So the manageable span of control is 3 to 7, with the optimal being 5. However, lean and mean, the term or phrase that we used earlier, still applies where we only use as few people as we need to get the job done. And that relates to resource management. We have to be very mindful. Public health agencies and other allied agencies need to be very mindful of their allocation of resources. And incident command speaks to that. Organizational facilities. So every incident involves, for example, an incident command post, which is the site where the incident is being managed from. I alluded to earlier about an incident action plan, which is a real-time plan, for example, from 2 p.m., I mentioned Eastern Standard Time, to 2 a.m. Eastern Standard Time. And then revisiting that plan and communicating that plan to all agencies and all personnel for the next 12 hours. Typically, these incident action plans for extended duration events are 12 hours at a time. Next is integrated communications. And last but not least, accountability. Let's briefly talk about management by objectives. So the objectives that we'll discuss are communicated throughout the entire organization in incident command system and are part of the incident planning process that we alluded to earlier. Objectives are based on the following priorities in order of importance. Number 1, saving lives. Number 2, stabilizing the incident, keeping the infectious disease spread from expanding, keeping the wildfire from expanding, for example. That's incident stabilization. And third most important is preserving property. Common terminology is absolutely critical under the incident command system, as throughout all aspects of what we've discussed today. And you'll recall that the incident command system is an old element, relatively speaking, about 50 years old, under a relatively new umbrella, that umbrella being the National Incident Management System. So one of the common critical features of the incident command system is common terminology. So efficient, clear communication with an incident command is absolutely critical. And the terminology accordingly requires use of standardized language and terms for organizational functions, facilities, resource descriptions, and position titles. Again, it's critical that one not use one's day-to-day position title in referring to oneself in the context of incident command, but rather the terminology that's standard to this model. I alluded to the manageable span of control, which is depicted on this slide. So you ideally do not want to have fewer than 3 boxes hanging down from a box above it, and you don't want more than 7 boxes hanging down from a box above it. So that's a range of 3 to 7 is what's considered the manageable span of control. If you have fewer than 3, you could probably do it yourself. If you have more than 7, you'd want to add another box and add new boxes underneath it to maintain that manageable span of control. The span of control considerations are influenced by a variety of factors, including the type of incident. You want to expose as few people to harm's way, so to speak, as possible. But you, again, want to keep in mind, as we discussed, the importance of lean and mean. We only want to use as many people as we need to get the job done effectively. And the manageable span of control, for example, is depicted here. When there is a power outage, there's a utilities group and a debris removal group. The utilities group, for example, might have 4 boxes underneath it. That's certainly within the manageable span of control of 3 to 7. And here too, on the right side, under debris removal group, we have 4 boxes under that. That's also within that manageable span of control of 3 to 7 boxes underneath a given box. Resource management is critical, as we alluded to, and as we'll go into more detail here. So organizations, any organization, has to make decisions regarding managing resources. In public health and any other governmental agencies, we have to make critical logistical, the word stuff, types of decisions to efficiently and effectively optimize what resources we have available. A very important note is that when we marshal a response, we mobilize equipment. At the end of a response, we demobilize those same equipment and supplies. But importantly, planning for resource demobilization should begin almost synchronously and immediately from the beginning of an incident. That may sound counterintuitive, but it's absolutely critical. We don't want to wait for the end of an incident just to figure out, okay, now how do we demobilize? That would be inefficient and ineffective. There are different types of resources, and these are terms under the incident command system rubric. Tactical resources are, for example, personnel and equipment. In this case, we're talking about personnel. So a responder is technically a tactical resource. There are 3 possible scenarios if you're responding to an event under the National Incident Management System, and specifically an incident command system. One is you're currently working on a response activity, so you're not available to do other things. Another is you've rested following your shift of response, and you're ready to be assigned, but you haven't gotten your assignment. And the third is you've just finished your response shift and you need to rest. So you're not available or ready to be assigned until you're adequately rested. Organizational facilities are critical, and they have standard terminology under the National Incident Management System and specifically Incident Command. When we talk about organizational facilities, key organizational facilities include, as I alluded to earlier, an incident command post. Every incident command response, and that includes, by the way, the varying flavors of incident command, such as unified command and area command, all must have a central place of operation. And when we talk about incident command, there's something called an incident command post. That's where the incident commander works out of. There are other types of facilities that are not as critical to memorize, but just to allude to here, those include camps, bases, and staging areas. Again, not essential for memorizing, but to know that these are different organizational facilities that are using standardized terminology. The incident action plan is a real-time plan, for example, for 12 hours at a time. And those are particularly relevant for longer duration incidents, such as a pandemic. Pandemics typically last historically 2 years or more. We saw that with COVID-19. We also saw that with the 1918 influenza pandemic. And so when we think about an incident action plan, they are typically 12 hours at a time and determining what is going to be done during that window. So when we think about reliance on an incident action plan, these are the elements. We have to think about providing supervisory personnel with directions for taking actions over that 12 hours operational period based on the objectives during that period. It may be that the objectives are to do mass vaccination in a certain segment of a geographical part of the community. All of these need to be very specific. In general, when in doubt, as I mentioned earlier, write it down because we want to make sure things are clear and coherent. Every incident action plan has to involve the following elements. What do we want to do during this operational period? Who's responsible for doing it? How do we communicate with each other? And what if someone gets injured in the process? So there's always a safety component, as you can see. The planning section chief, I might add, is responsible for the incident action plan. You may recall the IFLOP acronym. So the planning section chief is responsible for the incident action plan. And the incident action plan needs to be communicated to every box within the incident command system chart. So everyone needs to know, as a responder, what the incident action plan is for that operational period. Integrated communications are absolutely critical. We talked about interoperability earlier, and that can make or break a response. So having common and standardized radio frequencies can allow, and are essential actually, for effective response. Last but not least, accountability. There are a number of critical mechanisms for accountability. Without accountability, an incident command response cannot occur effectively. The elements of accountability, as depicted here on the slide, include checking in if you're a responder, familiarizing yourself or being apprised of the incident action plan. Unity of command means that each person has just one direct supervisor to whom they report. If you are supervising others, having a manageable span of control with a range of 3 to 7, and tracking resources, knowing where personnel and equipment are at any given point in time. So to summarize, the National Incident Management System and the Incident Command System represent the bedrock of response to a whole array of public health emergencies and disasters. It allows for a common structure and a systematic approach and a coherent terminology to optimize successful response across the all hazards continuum. Here are some useful references from the Federal Emergency Management Agency, or FEMA, and the National Association of County and City Health Officials. So I hope that this presentation gives you a sense of the incident command system and the National Incident Management System umbrella that covers it, and why these various constructs are so critical to deal with current and emerging threats to public health and safety. Thank you very much.